Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Kartika Putri. I'm from Medical Faculty of Malahayati University, Bandar, Lampung. So today I will to tell you about medical treatment of fracture. Now, bone fracture is a condition that can occur when the bone is severely injured, so that the bone structure is not strong, though withstood the impact caused by the injury. There are some things that can cause fracture. For example, when falling from a height, when falling from a high place, experience traffic accidents, exercising injuries, or when the bones are stuck in hard objects. In addition to physical injury, fracture can also be caused by a medical condition that makes the bone weak and loose, such as osteoporosis. This condition is characterized by decreased bone density, so that the bones are easily broken. Broken bone can be experienced by anyone and occur in any part of the bone. When experiencing a broken bone, the broken bone will feel very painful, swelling in the injured area, bruising, too difficult moving. When you have an injury that caused a broken bone, immediately go to the doctor to get further examination and treatment. Broken bones are generally treated by orthopedic doctors. If the fracture is handled too late or the handling is not right, it can increase the risk of bone deformities. So, handling of fracture is adjust the tip and location of the fracture that is experienced. The initial treatment for fracture is to return to broken bone to its proper position. The doctor can do this process manually or by surgery. If the fracture is severe or if there is an open fracture, the doctor will attach a tool to the bone in the form of plates, screw, or specially rods to unite and align two bones. After the bones are aligned, the doctor will attach a splint or cast so the bone do not move. The length of time it takes for bone to reunite is around 6 weeks or more. During that time, the doctor will prescribe medication to help the recovery process. And the following are some fracture medication that can be given by doctors. 1. Pain reliever. The type of painkillers, analgesic, that are usually given by doctors are strong analgesic, such as morphine, fentanyl, tramadol, or ketorolac. This is because pain in fracture is usually felt quite heavy, but for fractures whose pain is not too severe, mild analgesic can be used, such as ibuprofen and paracetamol. And second, non-steroidal anti-inflammatory drugs atau NSAIDs. Anti-inflammatory drugs by doctor can be in the form of ibuprofen, meloxicam, cetapam, and selexosip. Similar to analgesic, NSAIDs are also used to relieve pain. Not only that, this drug also works to reduce inflammation. However, The use of this drug must be according to doctor's recommendation and prescription, because some studies state that the use of an NSAIDs is associated with disruption or slowing down the process of burn recovery. The third, antibiotic. Antibiotics are usually given to fracture patients who undergo surgery or have open fracture. This aims to prevent infection in wounds or surgical incision. Antibiotics are also usually given prevent or treat osteomyelitis due to bone. Fourth, tetanus vaccine. When you have an open fracture, the injured part will also get injured. This one make germs at risk of entering and causing infection. One of the infections that need to be watched out for is tetanus infection. Therefore, your doctor might give a tetanus vaccine to people with broken bones, especially open fracture. During recovery, patients are also advised to eat foods rich in protein, calcium, and vitamin D. The intake of these nutrients play an important role in helping bones to reconnect and form bone strength. When you have a broken bone, it is not advisable to massage or divide a broken bone with curtain herbs or herbs, because this action risks causing complications that can hamper healing. After the bones begin to heal, the doctor may also encourage the patient to undergo physical rehabilitation or psychotherapy in the rehabilitation process. Doctors, so thank you for attention. Wassalamualaikum warahmatullahi wabarakatuh.